Yeah, and we're grappling with a lot of exactly what Taylor was talking about. So I started 8 years ago here. We had what's called our discovery program, which is career exposure. At two of our sites, kids needed a great GPA and they had to pay for it. And I was like, no, 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 we're not doing that anymore. So we flipped that, and now we are at all of our sites have the opportunity. So all 11 hospitals have that opportunity for students in their neighborhoods to apply, come get that career exposure. And then we offer, instead of, we used to have a stipend at the end, we are paying them hourly rate for 6 to 8 weeks in the summer, because we know we don't want that to be a trade-off ever for them to have those experiences in internships with us in the summer. We doubled our intensive programs that students are here, also paying them if we're forcing them to be here for our programming, we're paying them for every hour that they are here. We linked intentionally with our talent acquisition team with everything that we do. So kind of, I mentioned this before, but sort of stringing that pipeline. So if they use us, come to us for their high school internships, giving them opportunities for undergraduate internships or those apprenticeship opportunities, that we work a lot closely with our local community colleges or agencies like that. And then really handing them off, and kind of along the way, we're working on hiring students with disabilities and working with them and training them and giving them opportunities, and also working closely with our talent acquisition team to ensure that they can get the opportunities that they deserve, and we can accommodate them. And then, as Taylor was mentioning, we know that students are, when I started, I think everybody was sort of thinking in that 2 to 4 year college space, but that conversation has dramatically changed for us. We have a lot of students that are coming out of high school saying, I would like to start working now for all the reasons that you mentioned. And so we're thinking really intentionally about the departments where they can be most successful. We actually offer for full-time employees $10,000 a year in tuition reimbursement. And so students are getting really smart and saying, why doesn't my employer pay for me to go to school? We actually have direct pay for a lot of schools in the area, or virtual opportunities. And so they're taking advantage of that, and they're learning what they like to do and what they don't like to do. Like, come and try this on, and come and think about, is this what I want to be doing? Do I really want to be a nurse? Do I really want to go to nursing school? And having those opportunities, we put them a lot in patient transport, which is an amazing first job. It's a lot of customer service. It's a lot of meeting patients. It's learning about the entire hospital system and traveling all around and seeing, again, what you like to do, what you don't like to do. And all of that is critically important information in your first job. Yeah, and I think we're really thinking about retention, and I think that it really helps to think about what makes people stay. I think having your employer pay for your schooling is part of that, but we actually have a really high retention rate. We're at 7.5 years, which is 3 times the rate of other healthcare employers in our service area, and 4 times the rate of other industries in general. So we take that very seriously. We want people to come and to grow and think about not just their first job, but their career.